Heart disease is the #1 cause of death in the United States, and seniors are at the highest risk. Many people over 60 are unknowingly eating foods that weaken their heart while missing out on the ones that could save their lives. Diet is one of the most powerful tools to strengthen the heart, but the problem is that most seniors in the United States, the United Kingdom, Canada, and Australia are consuming high amounts of processed foods, unhealthy fats, and excessive sugars that fuel heart problems. Many older adults already have conditions like high blood pressure, high cholesterol, or diabetes, and these issues make the heart work harder, increasing the risk of heart attacks and strokes. Some seniors might already feel symptoms, shortness of breath, chest discomfort, fatigue, but they often ignore them until it's too late. What most people don't realize is that the heart is constantly under attack by inflammation and oxidative stress. But the right foods can act as medicine, helping to repair damage, lower blood pressure, reduce cholesterol, and improve circulation. Some foods have powerful compounds that fight plaque buildup in arteries, reduce dangerous clotting, and even strengthen the heart muscle itself. Yet so many people choose medications as their only solution, not realizing that simple food choices could work even better to protect their heart. Too many seniors rely on blood pressure pills and cholesterol medications without making real changes to their diet, missing out on natural ways to reverse damage and boost heart function. The good news is that the right foods can have an incredible effect, but it's important to know exactly what to eat and why these specific foods make such a difference. One of the biggest mistakes seniors make is assuming that heart problems are inevitable with age. But the reality is that many seniors in the United States, the United Kingdom, Canada, and Australia are accelerating heart disease through poor diet choices without even realizing it. Many people are still eating the way they did decades ago, not understanding that their heart becomes more vulnerable over time. Processed meats, fried foods, refined sugars, and unhealthy fats found in fast food and packaged snacks are silently damaging arteries, increasing inflammation, and making it harder for the heart to function properly. Many seniors are also consuming too much sodium, which leads to high blood pressure, forcing the heart to pump harder and putting them at risk for stroke, kidney damage, and heart failure. The worst part is that many seniors don't feel any immediate symptoms, so they don't realize the damage being done until they experience a heart attack or a life-threatening event. But heart disease doesn't happen overnight. It builds up over years of unhealthy eating, lack of movement, and chronic stress. What is even worse is that many seniors have been misled by outdated nutrition advice, believing that foods like margarine, vegetable oils, and low-fat processed foods are good for the heart, when in reality these foods contribute to even more inflammation and oxidative stress. Many people have been told to avoid all fats, not realizing that the right healthy fats are essential for heart function and can actually lower the risk of heart disease. There's also a major problem with seniors not getting enough key nutrients that the heart needs, like magnesium, potassium, and omega-3 fatty acids. These nutrients help regulate blood pressure, prevent dangerous blood clots, and keep the heart muscle strong, yet many seniors are severely deficient because they're eating processed, nutrient-poor foods instead of fresh, whole foods. Another major issue is that many older adults have poor circulation, meaning their heart is working harder than it should be. Poor circulation can lead to cold hands and feet, slow healing wounds, and even cognitive decline, as the brain isn't getting enough oxygen-rich blood. But the right foods can dramatically improve circulation, allowing the heart to work more efficiently while reducing the risk of clots, stroke, and even dementia. Most people don't realize that the same foods that protect the heart also support brain health, reducing the risk of age-related memory loss and cognitive decline. By simply adding the right foods, seniors can take control of their heart health, reduce their dependence on medications, and significantly lower their risk of heart attacks and strokes. The power of food is incredible. But the problem is that most seniors are never told about these life-saving foods by their doctors. Many doctors focus only on prescribing medications rather than discussing how simple dietary changes can be just as effective, if not more effective, at reversing heart disease. The good news is that it's never too late to start making changes. And by incorporating just a few specific foods, seniors can start strengthening their hearts, improving circulation, and protecting their bodies from life-threatening conditions. The key is knowing exactly what to eat and why these foods are so effective. The first food that every senior should be eating regularly for heart health is fatty fish, such as salmon, mackerel, sardines, and trout. These fish are packed with omega-3 fatty acids, which have been proven to reduce inflammation, lower blood pressure, decrease triglycerides, and prevent dangerous blood clotting. Many seniors in the United States, the United Kingdom, Canada, and Australia are severely deficient in omega-3s because they don't eat enough fish or high-quality seafood. Instead, they consume large amounts of omega-6 fats from processed vegetable oils, which fuel inflammation and damage blood vessels. Omega-3s help protect the arteries from plaque buildup, keeping them flexible and allowing blood to flow freely. Research shows that seniors who eat fatty fish at least twice a week have a significantly lower risk of heart disease and stroke. In fact, studies have found that people with higher omega-3 levels have a 30% lower risk of dying from heart disease. But the key is getting omega-3s from whole food sources like fish, rather than relying on low-quality fish oil supplements that might be rancid or ineffective. Eating fatty fish not only supports heart function but also improves brain health, reducing the risk of cognitive decline and dementia, which often go hand in hand with poor heart health. Seniors who eat fish regularly also tend to have better circulation, lower inflammation levels, and a healthier heart rhythm, which reduces the risk of life-threatening arrhythmias. However, it's crucial to choose wild-caught fish whenever possible, as farmed fish can contain harmful contaminants that might do more harm than good. Cooking fish in a heart-healthy way is also important. Grilling, baking, or steaming are the best options, while frying should be avoided because it adds unhealthy trans fats that damage the heart. Seniors who start incorporating fatty fish into their diet can dramatically improve their heart health within weeks, experiencing better energy levels, reduced inflammation, and improved overall well-being. Another powerful heart-protecting food that seniors should be eating is berries, including blueberries, strawberries, raspberries, and blackberries. These fruits are packed with antioxidants, fiber, and essential vitamins that help reduce inflammation, lower blood pressure, and improve blood vessel function. Many seniors in the United States, the United Kingdom, Canada, and Australia suffer from chronic inflammation, which silently damages the arteries, leading to plaque buildup and increasing the risk of heart attacks and strokes. The antioxidants found in berries, especially anthocyanins, help fight oxidative stress, preventing damage to the heart and blood vessels. Studies have shown that eating berries regularly can significantly lower bad LDL cholesterol levels, which is one of the leading causes of clogged arteries and heart disease. Berries also improve circulation by enhancing nitric oxide production, which helps blood vessels relax and widen, reducing the strain on the heart. This is particularly important for seniors with high blood pressure, as poor circulation can increase the risk of heart failure, kidney disease, and even cognitive decline. The fiber content in berries also helps regulate blood sugar levels, which is crucial because many seniors have prediabetes or type 2 diabetes, both of which dramatically increase the risk of heart disease. Many older adults consume processed desserts filled with refined sugars and unhealthy fats, which contribute to insulin resistance and inflammation, damaging the arteries over time. Replacing these sugary snacks with a bowl of fresh berries can satisfy cravings while actively working to protect the heart. Research has found that seniors who eat berries at least 3 times a week have a 30% lower risk of developing heart disease compared to those who rarely eat them. Another major benefit of berries is their impact on brain health. Seniors who consume berries regularly have been found to have better memory, sharper cognitive function, and a lower risk of Alzheimer's disease, reinforcing the connection between heart health and brain health. The best way to eat berries is fresh or frozen, without added sugars, and they can be added to oatmeal, yogurt, or smoothies for a heart-healthy boost. Seniors who make berries a regular part of their diet can experience improved heart function, better circulation, and a stronger immune system, making them one of the best natural medicines for aging hearts. Another heart-strengthening food that seniors should be eating is leafy green vegetables, such as spinach, kale, Swiss chard, and collard greens. These vegetables are loaded with potassium, magnesium, fiber, and powerful antioxidants that protect the heart by reducing blood pressure, improving circulation, and preventing arterial stiffness. Many seniors in the United States, the United Kingdom, Canada, and Australia are not getting enough leafy greens, which is a serious problem because these vegetables are among the most effective foods for clearing out plaque buildup in the arteries and improving overall cardiovascular function. One of the key nutrients found in leafy greens is nitrate, which the body converts into nitric oxide, a compound that helps relax and expand blood vessels, lowering blood pressure and reducing the strain on the heart. Studies have shown that seniors who consume leafy greens daily have a significantly lower risk of heart attacks and strokes, as these vegetables help prevent dangerous blood clotting and keep arteries flexible. Leafy greens are also rich in vitamin K, which is essential for preventing calcification in the arteries, a condition that makes blood vessels hard and narrow, increasing the risk of high blood pressure and heart failure. Another major benefit is that these vegetables are low in calories and high in fiber, helping to maintain a healthy weight, which is crucial, because obesity is one of the biggest risk factors for heart disease in older adults. Unfortunately, many seniors rely on frozen or canned vegetables that contain excessive sodium and preservatives, which can spike blood pressure and cancel out the benefits of fresh leafy greens. The best way to eat these vegetables is raw in salads, lightly steamed, or sautéed in heart-healthy olive oil, which further enhances their benefits by providing healthy monounsaturated fats. Seniors who start eating at least one serving of leafy greens per day can see noticeable improvements in blood pressure, cholesterol levels, and overall heart function. Another food that plays a crucial role in heart health is nuts and seeds, particularly walnuts, almonds, flax seeds, and chia seeds. These are packed with healthy fats, fiber, and essential minerals that help lower bad cholesterol, reduce inflammation, and support a strong heart. Many seniors are still afraid of eating fats because they've been told for years that fat is bad for the heart. But the truth is, the right kind of fats, especially omega-3s and monounsaturated fats, are essential for heart health and can actually help prevent heart disease. Walnuts are one of the best nuts for heart health because they contain high amounts of plant-based omega-3 fatty acids, which help lower triglycerides and reduce inflammation in the blood vessels. Almonds are also extremely beneficial because they are rich in magnesium, a mineral that helps regulate heart rhythm and prevents blood vessel constriction, reducing the risk of high blood pressure. Flax seeds and chia seeds are particularly powerful because they contain both omega-3s and fiber, which help remove excess cholesterol from the body before it can build up in the arteries. Studies have found that seniors who consume nuts and seeds regularly have lower levels of bad LDL cholesterol, lower blood pressure, and a reduced risk of cardiovascular disease. However, it's important to avoid salted and roasted nuts, as excessive sodium and unhealthy oils can cancel out the benefits. The best way to consume them is raw or lightly toasted, and they can be added to oatmeal, smoothies, or salads for an easy heart-boosting meal. Seniors who make nuts and seeds a regular part of their diet often experience better energy levels, improved circulation, and a stronger heart without relying entirely on medications. The final food that every senior should be eating for a stronger heart is avocados, which are loaded with heart-healthy monounsaturated fats, potassium, and fiber. Avocados are one of the best natural sources of potassium, a mineral that helps balance sodium levels in the body, preventing high blood pressure and reducing the risk of stroke. Many seniors in the United States, the United Kingdom, Canada, and Australia are not getting enough potassium, largely because they consume too many processed foods loaded with sodium. This imbalance puts excessive strain on the heart, increasing the risk of hypertension, kidney disease, and cardiovascular complications. Avocados also contain powerful antioxidants like lutein, which help protect blood vessels from oxidative stress and inflammation. Research has found that seniors who consume avocados regularly have better cholesterol levels, lower blood pressure, and a significantly reduced risk of heart disease. Another major benefit is that avocados are rich in fiber, which helps regulate blood sugar levels, reducing the risk of diabetes, a condition that dramatically increases the chances of heart failure. Many seniors struggle with high cholesterol, but avocados have been shown to increase good HDL cholesterol while lowering bad LDL cholesterol, preventing plaque buildup in the arteries. The best way to eat avocados is fresh in salads, on whole grain toast, or blended into smoothies, avoiding processed guacamole products that may contain unhealthy additives. Seniors who incorporate avocados into their diet often experience better heart function, improved digestion, and a reduced risk of cardiovascular complications, making them one of the most effective heart-protecting foods available.